So we will go through this with them on counselling. So most patients, if providing they're not, say, diabetic on insulin, will come in on the day of surgery, and like with an anaesthetic, would be starved from midnight. They obviously would have the operation, hopefully under a general anaesthetic if they're allowed to from a pre-assessment point of view. Occasionally it might be done under something called a spinal. When they wake up from the operation, the man can expect to have a urethral catheter, which is a drainage tube coming out their penis, which drains their urine. The implant is kept inflated and there's a bandage around the penis and around the scrotum. And then they'll also often have a little drain in, draining some blood. And then they can eat and drink as normal when they wake up, and they'll be given painkillers to help them with their pain, but although they'll also have probably been given a bit of local anaesthetic during the operation. So they'll eat and drink as normal, and then the next morning we come round, we take their dressing down, and then we deflate their implant, which has been left inflated. That can normally be a little bit sore, and we'll tell the patients that when we see them, so to expect that. So we tell them that will be uncomfortable for a few seconds, and then the prosthesis will be deflated as much as possible. The catheter would then be removed, followed by the drain. And then once they're passing urine, so going to the toilet, we'd let them go home. Usually they'd have a little pad to support their scrotum, and we'll tell them that they'll get some swelling and some bruising, and that will usually come out after a couple of days, and they'll feel very sore. So we do tell the men that this is a sore operation, but the soreness does not last forever. Eventually you would say you'd be sitting in front of me as you are today, you'd be comfortable, but the first few weeks are sore. It takes a little while to get over it. You may not be able to work for a few weeks, and you may feel quite miserable. And I have had some chaps, in honesty, who've said to me, oh, you know, why did I have this done? But then I say to them, you'll be, you know, you're saying this now because you're sore, but trust me, you'll be okay in a few weeks. And they will. They'll come back after that and say, you're absolutely right. I'm really pleased I had this done.
We normally see patients back 3 weeks following the operation. We do give them our contact details, so if they have any problems between their outpatient appointment and their discharge and their outpatient appointment, well, then we will see them earlier if necessary. But when we do see them, we check their wounds. They normally just have a scrotal wound, but if they've had abdominal surgery previously, it may be that the surgeon will make a separate incision to visualise and directly put the reservoir into the lower abdomen. So we'll check the wounds, and we will inflate and deflate the implant if we can at that point at 3 weeks post-surgery. Sometimes there can be formation of a hematoma, which is a jellified collection of blood surrounding the pump, which makes it difficult to appreciate the anatomy of the pump when we see them. So if that's the case and we can't comfortably feel the deflate mechanism, we won't try and inflate the device. We'll let everything settle down for another 2 weeks or so and get them back to clinic, at which point we'll then have another go at cycling the implant.
Generally, we try and tell people, wait till you come back to clinic for us to teach you. And I've had some chaps who come back and they straight away can inflate and deflate it, whereas some men it takes a bit longer. I remember when I first started in the job, I took a little while to get used to it, but it's like anything. So it's just time, and we'll give men the time they need, but they do get it in the end.